Cases and hospitalizations are setting new records, and with hospitals struggling to keep up, some COVID patients are turning to a drug that's commonly used on livestock.
It's called Ivermectin. It is prescribed to some people in much smaller doses for other ailments, but the FDA is now concerned that people are turning to a different form of that drug that's made for animals.
Our Michael Lepardi live in North Houston tonight to explain the differences between the two versions of this drug. Michael?
Dominique and Chris, the medicine comes in different forms for animals, including right here at the store that's just behind me. The owner told me that people are calling about it every day, and there's some concern from the FDA about people possibly self-medicating with animal products. The message from the Food and Drug Administration, seriously, y'all, stop it. The agency warning people not to use ivermectin for COVID-19, but that hasn't stopped interest in the medication, which is commonly used to treat parasitic infections or worms in animals like cows and horses.
We have seen an increase of people calling and asking for the particular product.
One of those products at Big Tech's Feed, Hardware, and Pet Supply clearly marked not for use in humans. And over at Wabash Feed and Garden,
we have more and more people who are calling about it because they want to use it as a preventative.
We took our questions to Dr. Jill Weatherhead, an assistant professor at Baylor College of Medicine.
At this point, ivermectin is not recommended for treatment or prevention of COVID-19.
She says the medicine can be prescribed in certain doses for parasitic infections in people, but that's not the same product on the shelves at feed stores.
The formulations are different. There are different non-active ingredients at different concentrations. The concentration of the medication is usually higher in animal medications than in human medications, so they're not equivalent.
Weatherhead says the lab studies suggesting high doses of the drug can control viruses like COVID were from a petri dish.
The clinical trials that have been done to date have not shown efficacy or benefit of this drug in preventing consequences of COVID-19. Including mortality and severity of disease.
The local feed stores told us they sell the animal product in pastes and liquids, which can be bought off the shelf, and they can't control what people do with them when they leave. The FDA says that large doses of the drug can be dangerous for people, and more testing is needed when it comes to use for COVID. The doctor that we spoke with says the best strategy to protect yourself right now is the vaccine. Reporting live tonight, Michael Lepardi, KPRC 2 News.